Hello and welcome to the show. I'm your host Jake Hersamaki, and today we'll be taking an in-depth look at osteoarthritis. Osteoarthritis is a pathology that is more common in older adults and within weight-bearing joints. It is characterized by asymmetrical cartilage loss within a joint, leading to a loss of mobility and functionality. The development of osteophytes, subchondral sclerosis and subchondral cysts contribute to the degradation of articular cartilage within the joint. As osteoarthritis progresses, the joint space narrows and the synovial membrane may become inflamed, leading to synovitis. Today we'll be focusing on osteoarthritis of the knee, which is clinically diagnosed with a history assessment and physical examination of the joint using anatomical imaging techniques. To tell us more about these imaging techniques, we have Queensland Health radiographer Stacey Robertson.
Thank you, Jake. So the modality we would be using to diagnose osteoarthritis, as well as assessing the severity of the particular patient's condition, is an X-ray, since it is a bone disorder. We would look for abnormalities such as narrowing of the joint space, which is one indicator that the patient has osteoarthritis. Sometimes bony spurs may be visible on the X-ray, which is another indication of osteoarthritis. In some cases, for further clarity and a more accurate diagnosis, an MRI scan may be necessary because it allows us to see whether any damage to the soft tissue has taken place in the joint, which is important for a correct diagnosis.
Would these scans help in identifying what symptoms I might feel?
Scans can help with identifying what symptoms are present. What are you feeling?
Well, the current advice from doctors was to actually build up my quadriceps, hamstring and various hip muscles, as further progression of my knee deterioration will actually lead to a drastic reduction in my ability to both move and also build up muscle to be able to move the knee. Currently, I only feel tenderness, but late stage is where they say I should start feeling extreme pain in the knee, along with massive reduction of flexibility and be able to move it together, and a grating sensation along with bony spur. So with me here, I have Dr. Mel. She's here to show images of my knee and show me what's wrong with them, and also show the current progression path I'm on. So Dr. Mel.
Thank you, Dion. In this radiographic image of Dion's left knee, the narrowing of the joint space can be visualized more medially. It appears radiolucid and can be described as a thin linear line located between the medial aspects of the femorotibial joint. However, in this patient, the narrowing of the joint space prompted the joint space to collapse, destroying the medial cartilage and the subchondral cortex. Back at Dion's scans, the formation of osteophytes is evident in the small anterior medial aspect of the distal femur. They appear radiopaque on a radiograph because of their bony structure and appear triangular in shape. Subchondral sclerosis is another hallmark for identifying and diagnosing osteoarthritis, which is characterized by the wearing away of subchondral bone underneath the cartilage. This results in a bone to remodel thicker because of the subjected stress and changes the appearance to a normal knee joint. In the comparison of a normal knee with no pathology to an osteoarthritic knee shows a marked difference in the bony radiographic appearance of the structures. On the left side of this image, we can see the radiographic image of a normal knee with adequate joint space. However, the radiographic image of an osteoarthritic knee on the right shows a significant loss in joint space to the medial aspect of the femorotibial joint, and the formation of osteophytes on the medial condyle adjacent to the joint space, as well as the development of sclerosis on the lateral condyle of the tibia.
The major contraindication for osteoarthritis is exercise therapy, since further manual wear and tear to the non-regenerative articular capsule would quicken cartilage degradation and worsen the condition.
So Tabitha, is there any likelihood of misdiagnosis?
Yes. Although the patient's right knee under X-ray is clearly symptomatic of osteoarthritis, radiology of the knee can be misinterpreted quite commonly, so it's imperative to identify anatomical discrepancies that will correctly identify the pathology. The most common condition mistaken for osteoarthritis is rheumatoid arthritis, which is an autoimmune disorder presenting with a similar narrowing of the articular space seen here. The distinction between these pathologies is the presence of bony spurs in osteoarthritis visible here, and contrasting periarticular erosion in rheumatoid arthritis, as shown here. If we focus on identifying these differences in X-rays, we can more easily discriminate between these two pathologies and prevent misdiagnoses.
And that was osteoarthritis of the knee. Thank you and good night.